can you start by giving us a brief introduction about your background in the medical industry and OT&P?
Sure. Well, the first question is easier. Myself, I'm the Managing Director of Clinical Operations at OT&P. I am by training a psychiatrist, and I still see clients these days apart from doing my admin work. OT&P Healthcare is a company that's been around since 1994. We were established by two British GPs way back when, who are still practicing now and who are still very much involved in the operations and the strategy of the company. Because they were ex-med doctors, and so the clinic locations that we opened over the years have been mainly more ex-med focused locations and the relatively more affluent areas. So you can see we have clinics in Central, we have clinics in Clearwater Bay, and also in Repulse Bay as well. Over the years, we've grown from just a GP clinic to a multidisciplinary clinic, and with a wide range of specialties, and also seeing more than 90,000 consultations in 2024. The last bit to intro is just the list of specialties that we have. It is a very long list, it's a very big thing, but overall it's basically saying that we try to have every specialty in medicine that people will need to see. So therefore, what we aim to do is, if a patient comes to see us for any healthcare needs, we have a solution for them. And we try to, much like what the government is trying to do these days, we try to adopt a really British-style family doctor approach. That is, they're not coming down to sit down for a 3-minute consultation and then just kick you out even before you sat down properly in the chair. We properly ask you about your health, and we want to care about your well-being and also how to help you maintain your well-being as well.
Thank you for that. Now, speaking of government, there is something very interesting going on with the healthcare industry in Hong Kong. Because on one hand, you're having the government doing a public healthcare reform.
Yep.
And then there's new requirements for licensing, and there's all sorts of other stuff going on behind the scenes. So can you give everybody a brief overview of what's happening in your industry, and more importantly, how is this going to affect everyone here? Because we all need healthcare.
Sure, exactly. Well, so healthcare-wise, I think much like any other Western countries, any industrialized economies, healthcare spending is just going up year on year. Whether this is total healthcare spending, private healthcare spending, or public healthcare spending by the government as well. The issue is, though, is that the reason why government is doing this healthcare consultation, healthcare reform, is because they know how lopsided and unbalanced things are. So take, for example, just the mix of the inpatient and outpatient service provision. Inpatient meaning, having to stay in the hospital, right? The public sector accounts for 85% of all inpatient consultations, whilst the private sector constitutes 68% of all the outpatients. So government clearly does a lot more inpatients than outpatients. However, if you then look at the distribution of manpower, especially doctors, it is actually the other way around. There are more doctors in the private sector. It's actually the top line. It's kind of hard to see that. About 55% on the private sector versus 45% on the public sector. So therefore, what it's saying is the public sector is dealing with way more inpatient care, which takes a lot more time and a lot more care, but with fewer people in the total medical sort of manpower industry. Which is therefore why it makes sense to have this thing. The main purpose is just so that we want to make sure that the public sector is able to provide the care with a good quality and a not too long waiting time to those most in need. Li Ka-shing is technically eligible for public health care because he pays taxes. But then, we want to save public health resources for those most in need. So I think this is why this whole consultation started. And personally, I think it's a good direction to at least start this discussion in the community as well.
Okay, thank you very much. Now, I know that you have a solution for everything, but can you just point out some of the niche that you have, especially for corporate wellness?
Well, I try to have a solution for every healthcare needs in Hong Kong. I might not be able to, but I try to. Corporate wellness, we all know that every corporate is actually made up of its individuals. And I'm sure every company here believe that the most important assets, apart from their IPs and also the products, their products is also their people, and the people behind the ideas and innovations that everyone's able to produce. So therefore, it is as important to ensure that everyone's well-being is as important as the corporate well-being. So that's why we try to make sure that everyone is doing their best to maintain their own health. We have tailored wellness programs. I myself work in mental health and I'm a psychiatrist, and so therefore I do loads of talks to different companies about how to maintain your mental well-being. We tell people, we educate them about what different mental illnesses are. People here might have heard of neurodiversity as well these days. You talk about autism or ADHD. How do we then harness the potentials of these people with these neurodiverse backgrounds in order to help us do what we can? To give you a very brief example, for those of you who are slightly more nostalgic of old movies, there's a movie called Rain Man, Dustin Hoffman, way back when, autism gentleman. But he could clearly recite every single thing off like the almanac, and he remembers things to very minute detail. He can also be very meticulous. So for example, can we harness someone like him if we need to do something like accounting, for example? They can be very meticulous, they are very detail-oriented, they know exactly where things are, each number. So there is a contribution that people can make, but many companies don't know this. So our job for mental health support and also peer support is also to ensure that everyone kind of is able to harness and understand each other's potentials, and also ensure that everyone has a good mental well-being. Stress, depression, anxiety is the biggest dragger for companies and performance these days as well. So that's why we try to help companies ensure that the employees have a good mental well-being.
Lovely. Now, can you tell us what's in the pipeline for OT&P this year? Because I know you guys are spending, there's a lot of new things going on. What's happening?
Traditionally, we have been always placed in a more affluent neighborhoods, Repulse Bay, Kyoto Bay, Central. We also know that most people in Hong Kong don't live in those neighborhoods, and so therefore there's a need to reach the wider audience and in more sort of middle class areas as well. And so therefore we are trying to serve more communities with trusted healthcare. And again, I emphasize, this is not the GP 3 minutes, sit down, kick you out like in medicine. We want to provide high quality personalized care to a more diverse community. And so therefore, we're trying to expand our clinic network and also create a subsidiary sort of brand so that we can deliver high quality primary care to more people in the community. We're also trying to develop more on children's mental health. For example, I myself see loads of kids with ADHD and anxiety, depression, unfortunately, but this is a bigger problem over the past few years. And then also, there's a big thing these days about longevity and wellness.